everybody. Welcome to Foster Friday Live. We are so glad that you are tuning in today, and we are just absolutely thrilled. We took a little field trip to the state office, and we are just so excited to be able to talk to Gwen and Nikki. And we're going to be talking about kind of some pointers and tips for foster parents as they navigate caring for their children, their health and well-being and doctor's appointments and some of the things that get kind of tricky and confusing. And there's lots of changes coming and exciting reforms that we're going to talk about. So thank you both for being here. And thank you guys as you join us. Just let us know that you're here. Feel free to ask questions because we want to make sure that we are providing you with the best information possible that's going to help you to serve children. So thank you again. And will you guys just introduce yourselves and let us know who you are?
Yeah. Hello, everyone. My name is Nikki Brown. I am a program coordinator here for the Office of Child Health and Wellbeing, and I am so happy to be here with y'all.
And Nikki's been wonderful to have in our office. She's a great resource if any of y'all need to ask her questions. I'm Gwen Goodland. I'm the Director of Child Health and Wellbeing here at DSS, and this is a relatively new office. It's it's almost coming up on its 2nd year anniversary.
Okay.
And so it's part of a lot of the reforms that are happening right now, the really positive changes that are happening at DSS.
So can you give us just maybe a quick overview? What does your office do? What does it oversee?
Okay, so when you think about child health, think about things like well-child visits, dental visits, if children need behavioral health, like maybe they might need counseling or regular counseling sessions, things like that. So that's the health. The well-being part are all the other things that go in to make that possible.
Quality of life.
Yeah, it's quality of life. And we're measured by the Children's Bureau, and a lot of the measures that we look at for well-being include things like are foster parents involved in the planning for this child? Are there regular visitation schedules happening? Do we have a good service array for children? And are those kinds of things are the kind of dental health and physical health, and then behavioral too.
Right. So now you guys wouldn't be the frontline persons that a foster parent might reach out to first in terms of questions or accessing services. That really would be the frontline person. The first person might be the caseworker. Is that right?
That's right. But I interact a great deal with foster parents. We get questions all the time. There are some foster parents who are confused about how does this work and what do I do? And I try to take my child to the doctor and this and that. So we are very open and very happy to help. We've got a series of flyers here that say, we're here to help, call us.
Yeah, that's awesome. And I mean, I think that's something that foster parents are looking for so often, is someone who's just willing to say, like, you're right, this is confusing, and I'm going to be willing to talk to you and just even take a few minutes out of my day to help you understand. So as we're talking about kind of the role of foster parents and caring for these children, what does that look like in terms of kind of the foster parents' role and their responsibility in caring for these children and making sure they're getting all the appointments that they need and kind of that whole array of services of health and well-being?
Well, so you all are very much the first advocate for these kids. You're really on the front line, and you're the person who's not only going to advocate at various appointments, but you're also the person that's going to be communicating back to DSS about what's happening with that child. Because a lot of times, y'all are the ones that are making the appointments. You're the ones actually taking the child to the appointment. You're the one actually who's sitting there, and the doctor's like, here's what happened in the visit today, and here are the things we need to follow up on. And for foster parents, that can be a lot. It can be overwhelming.
Yeah.
But that's what one of your primary roles, for at least for the health side, is to help make sure that DSS caseworkers and our office know what needs to be done to help children have their needs met.
Right. So kind of coordinating those things and then also communicating back.
Exactly.
Closing the gaps or connecting those dots.
Right, because those foster parents are with the children 24 hours a day, which case managers aren't. And so they are the experts on the child, because they're able to give us, these are the behaviors, or these are the medical needs that I've seen that this child may need, and they would have to communicate that to the doctors and the case managers, so we can work together as a team to coordinate those services.
Right. So, and then we're kind of excited to talk about, tell us about some of the reforms that are happening with the child well visits,
Sure.
which obviously the foster parents would be a part of.
Absolutely. So this is something that's new, Kaylee, that a lot of people are don't know about.
Mm-hmm.
But we have an enhanced well child schedule. So if you've had maybe a foster child before, foster child, let's say, was 6 or 7 years old, how many times a year do you go to the doctor?
Once, or if there was a need.
Yeah. Well, if you're sick, you might go. But for a well
Right.
child visit, you just go once a year.
Yeah.
Well, best practices tell us that children in foster care really need to be seen more by a doctor.
Okay.
They move around a lot. There's a lot of times when their needs can get missed, but having them into the doctor twice a year after the age of 2 is really a best practice standard. So this new well child visit schedule for babies looks like this. That first 6 months of life, you go monthly.
Mm-hmm.
Once a child turns 6 months to 2 years, then you go every 3 months.
Mm-hmm.
And then after they turn 2 years old, it's every 6 months. So think about it, 1 month, 3 months, 6 months.
Okay, that
really,
makes sense.
Yeah.
Yeah. I mean, it's not like a whole additional array of appointments. It's just one per year.
Correct.
Yeah, for those older children.
Yeah, they'll go twice. So it's just one more than you normally have.
Right.
And so we're on a big push right now as part of our reforms to make sure our system like we have in our system, we know when that child went to the doctor, we know what happened at the doctor, and we know what needs to be followed up on.
Mm-hmm.
So the most important thing, if you take away one thing today from this, it's that. No, it's 3 things. Sorry.
Yeah. It's never just one.
It's never just one. Make that well child appointment.
Okay.
Second, if you've got a kid over the age of 2, they need to be seen twice. If they had it 6 months ago, go make that well child appointment, well child visit. Go call it right now. If your doctor says, "Oh no, this young man
already had one,"
they've already had one. No, you can't. We call our number. We'll give you our number. We'll give you a flyer. We can help you navigate that with Select Help. They'll actually call the doctor and say, "Hey, doctor, guess what? We have unlimited well child visits now for children in foster care."
Right. Okay.
It's a great
So
service.
there's not a barrier of the insurance or access to the resources, and if there is an appeared barrier, you guys will help kind of overcome that, because they really should be going to the doctor twice rather than just once a year for those well visits.
That's right.
Okay.
And we have flyers that will connect to the Facebook Live page.
Yes, we will connect all of those in our links. And Emily says, great looking child welfare professionals. Such an important topic. So thank you all. You're making us look good.
Well, genuinely, when we talk about it, it's genuine excitement about this. Because, we really, really want to see, children's health improve, and we know we can't do this by ourselves. That we're all in this together,
right?
And we really know that it's going to take really a whole team of coordinators to make it happen. So.
Yeah. So, talking about, being a team, foster parents might not, come into fostering or parenting with really a wealth of knowledge and experience about health and well-being, and especially maybe the intricacies of some of the things that children in foster care may be facing. So what do foster parents need to do or know to be successful, in caring for these children, making informed decisions about their health care, consenting to medications, or what can you tell us that foster parents might need to know to be successful?
The first thing that comes to mind is, one, they're not doing it by themselves.
Right.
There's a team of us, case managers, guardian ad litems, the medical doctors, really the community is there to help that foster parent and the child just be as successful as possible. But then
So we really shouldn't be going at this alone. We have to tackle all these things by ourselves.
Not at all.
We have a team, so just to tell you, even to build on that, you don't have to be the expert. That's why you have a pediatrician.
That's a good thing. Yeah.
You don't have to know all of the intricacies. You just get them to the pediatrician, and then we go from there. We'll help guide you through there. And we've got a whole team of people now at DSS. I don't know if you're familiar with the fact that we have a nursing staff now.
Yes, and we're going to talk about that. We're excited to talk about that because that's huge, brand new, and maybe something that foster parents don't know about.
Exactly.
So that's awesome.
We also have a whole team of a dedicated staff of 19 people at Select Health that were not there before. There was a small group of maybe one or two.
Yeah,
four or five.
So, and foster parents might be getting calls from these people,
yes,
right?
Yes.
And maybe very concerned about giving information, but they have permission and really are encouraged to be answering and communicating with Select Health.
Yes. So let me tell you how that works, because that might be helpful. Yeah. It's a weird call of it. We're like, what's going on here? So what happens is we find that if someone's reaching out early on when that child first comes into care, or that child has a placement movement in a new location, that if someone is connecting with that foster parent, helping to set up that medical home, helping to make those first appointments, helping figure out where they need to go and what they need to do, that it's really good. It helps kids' care be
ease
continuous.
That transition.
And so part of their process at Select Health now is they have this care coordination unit. They will call you and they'll say they have to verify first through HIPAA that they're talking to the right person. So that's why it's this kind of awkward and a little bit weird. Have you had one of the calls before?
Yeah. So I've gotten a couple calls, and to be honest, the calls have been for temporary placement, so they've already moved on to a permanent placement, so it is no longer a child in my care. But I have heard from other foster parents through our local foster parent association, through our Facebook group. Some parents are saying, I'm refusing to talk to them, I'm not answering these calls. And then I have also heard from the ones who do answer and provide the information that then that person gave them just invaluable help. Really talk them through it, resources, services, kind of coaching them. That is sort of as like a nursing coach or a mentor. Health coach. Yeah.
So you've really nailed it on the head, Kelly. That's really what this is designed to do, is to be there as a resource. You're not in it alone. And there's so many people that want to help coordinate care. And that's that first call, that first pickup, that Select Health touch it's okay to respond to them, and they're appropriately helping to help you. And I know some people like,
is there maybe a sign or something that foster parents should look for to make sure that this is not a scam? Like what might be something that is said that would indicate, okay, I am able to share this child's information?
So I think the best thing probably would be to help to make sure that you all have the flyer that talks about what Select Health does. And then some foster parents have told us, I didn't feel comfortable with somebody just calling me and giving me information. I wanted to call them back.
Right.
So at the bottom of that flyer, it's got the Select Health number, and it tells you to press option 3, and that sends you to that foster care group.
Okay.
So if you feel uneasy, or now that hopefully this is the call you should be getting, you won't feel as uneasy about it. But if you do, you can call them back and press that button 3, and you go right to the group that works with foster care.
Great. So, and we've been talking a little bit about, there's this new medical consenter and psychotropic medication training.
Yes.
We want to talk a little bit about the training, but first, would you consider a foster parent to be are they considered a consenter or a secondary consenter? And what does that mean?
Right. I'm happy to take this one.
So, foster parents are considered secondary consenters for children who are in foster care. They have to fill out a DSS form saying that they've completed the training, and they have the child in their care, and give that form back to the case manager so that the case manager can file in our physical files, but then also they can take that form with them to the doctor's appointments to let them know, I have secondary consent over this child in my home.
So a foster parent is not automatically a secondary consenter. They have to have that certificate that they have completed the training. And it is a new training, so this might be new information for some people. But they can either be doing the training online as they're, by themselves, because they need to. But this is also being done as group training through the foster parent association.
Through the regions.
So it's not both, it's either or.
Correct. You don't have to do both. And actually what we're working towards is we listen, because we've heard folks say, this is a lot. Is there any way we could do this before foster parents even come into service? And so you'll be hearing some more messaging coming out about that. So that it's you do a little refresher every year, but it wouldn't be this longer, bigger training. So it would be, think about it, Kaylee. If you're making decisions for a child, you want to sort of know what you're doing. You want to make sure you're making good decisions. And so a lot of what this is not to make things more difficult. foster parents, not to make you jump through more hurdles, but to make sure that you have that basic health literacy and you understand, what you're consenting to, especially on psychotropic medication. There's a form. DSS, we always got some forms,
right?
Because we want to make sure we document it. But so do you know what psychotropic medications are?
Yeah.
Okay.
Yeah. So, well, you guys can explain it much better.
Well, no, but they're medications that might help address a behavioral health need or a mental health need. And so when you consent to a medication like that, like it might be something like something used for ADHD, it might be something that's used for depression, anxiety, those kinds of medications. We want to make sure that you really know what you're consenting to. So we have to have the training. Then there's this psychotropic medication consent form.
Right.
So.
Because it's important that foster parents are able to recognize some side effects of those psychotropic medications, because if they don't know what the side effects are, they may not be able to catch something significant happening with that child.
Right, and this is a great segue to kind of what we're going to talk about next, is trauma as this great imitator, and the fact that we know through research that children and youth in foster care are either have a higher rate of mental health disorders or are being diagnosed at a greater rate. But Emily has a great question, kind of going back to our conversation about
How can you see that far away? I'm
so
impressed.
Well, I walked up and read it.
I'm like, wow, that's impressive.
So Emily says, what is available for foster parents with the Select Health team? So we've talked about those initial phone calls.
Correct.
But then what else? Can we call them anytime or?
Yes.
Okay.
So you can call that number, press that option 3, and a couple things. Let's say you've run out of medication. Child just came into care. They're not supposed to be on medication. You don't have any. You're desperate to get some. What do? Help me out. You can call them, and they're there to help. Also, if you have situations where you're trying to find a doctor, and maybe you're having a hard time getting like you said, you had temporary children in your care, but you're trying to get them in to be seen by this doctor, and the doctor can't meet that. Hey, could you help me find a new doctor so I can? So
these are kind of the fairy godmothers of foster care
good
health system, right?
Exactly.
They can kind of wave their magic wand and help you find those resources and services urgently, where healthcare providers may not have the knowledge or ability to provide those services urgently,
and help you problem solve.
Right.
Like you've got a partner there that if let's say you need some durable medical equipment, so the child has a specific type of device that they use.
Right.
They can help you with that, and they can help you walk through the process that you need to do to get those things in place.
So these Select Health teams, they are for standard foster parents and therapeutic foster parents and kinship care providers also?
Well, they have to be in Select Health.
Licensed.
Well, no. Okay. Well, so there are. I didn't know all this until a few years ago. I was going to tell you, but Select Health is what you call a managed care organization, and there are 5 of them for children on Medicaid. And as you know, when a child comes into foster care, they're placed on Medicaid right away, and they're assigned typically to Select Health. Okay. And so that's usually the MCO that we deal with for children in foster care. Gotcha. But if you're not in foster care, it could be any managed care organization.
Right. Okay. So depending on what they have been assigned, and it's typically Select Health.
And typically, children in kinship care are in foster care. They're just in foster care with a licensed relative.
Yes.
Right. So for kinship, there might be a little bit of gray area, but this probably will apply if the child has entered foster care and then been placed with a licensed relative.
Correct.
So, and we have a couple more questions here.
Oh, good. I love questions.
So Deb says, can you tell me where to find services for kinship? So for grandparents raising a child who needs services after foster care.
Yes.
And then that's awesome. And then we've got another question from Jill. So for kinship, grandparents raising, it sounds like maybe the case has been closed. They've been in foster care. How can they find additional resources and services? That's a great question because what exists after?
Right.
If the child is still on Medicaid after they exit foster care, and typically they are, depending on if they stay with Select Health as their MCO, they will still be able to get services from Select Health. It may not be the
exactly the
same, but they're still a resource for those people it's a service for everybody, not just kids in foster care.
Okay. So Deb, I'm going to say call Gwen and Nikki. We will link to their contact information afterwards.
Sure.
But figuring out what Medicaid and what care, what did you call it?
Managed care.
What managed care organization it is, and there might be some differences, but they would provide some additional services or at least point you in the right direction.
And really, every managed care organization has people that will help coordinate care. It's just that we are very fortunate to have many more that are here just to work with the children in foster care.
Right. Okay, and Jill says, can they help us get prescriptions refilled when a placement comes to us midway through a prescription and it's not time to refill and medication didn't come with the child?
Sure. Yeah, that happens a lot. That's
right. So I think maybe a child has been placed in your home. They have previously been on a medication or have a current prescription, but that didn't come with the child for whatever reason.
Exactly. So they are a great first stopping point. When we attach that flyer, you'll see a number at the bottom down there.
Right.
That tells you the number to call. Call that care coordinator and say, hey, this is my problem. We've got a week's left of medicine. Can you help me get into a provider that can prescribe it? If it's not a child psychiatrist, can you get me to a primary care doc that can help us get this medication filled and help us make sure we don't have any gaps?
Okay, so one-stop shop, fairy godmothers, call the Select Health team. We're going to put their phone number and their email and their website everywhere to make sure everyone has links to that.
And I'll tell you another thing too. Sometimes this is open to anybody that's a Select Health member as well. You need to talk to a nurse. You need to talk to a nurse at night. I don't know if you have
on the back. Yes, on the back of that card from
Yes.
Select Health. Once you get that card, is the number, right?
Correct. So that's that 24/7 nurse line. So if you need to talk to somebody, you can call that now. It takes a minute. They call you back, and we tested it, and they've gotten phenomenal reviews from foster care.
Yes, I've used it a couple times, and I think it did take them about 2 hours to call me back because it was a weekend, and but really she was able to give. Once she was able to calm me down, but then just tell me what to do next, and so that was very helpful. So Jill, does that? I think that answers your question, but we could kind of talk more about that. But it sounds like these select health teams are just going to be invaluable. So awesome, thank you. So so we're going to kind of talk about psychotropic medications, kind of connected to trauma and mental health, and kind of what is the connection and why are we seeing the training is so important because we are seeing so many children and youth in foster care being prescribed psychotropic medications. Can you just talk to us a little bit about that? Is there a link? What is the link? Or what do we need to know about that?
So I'll tell you one of the things that I've learned over the course of working with children that have specific behavioral health needs, foster children and all other children involved with various state agencies, is that we have a saying that's bad behavior is unmet need. So if you have a child in your care and you're caring for them and you're seeing some behaviors that, we say in air quotes, bad, what is that child trying to communicate to me? They're communicating there's a need, and what is that need? And you mentioned trauma. It could have been trauma that the child is experiencing.
Right, and we know all these kids have experienced some type of trauma.
Right, and not all rises to the level where you need medication. That's the conversation you have with your doctor. And that's the conversation where if you are on medications that are beyond what your primary care doctor would prescribe, you could talk to a child psychiatrist.
And that's the step that I have found really challenging. We talked to our primary care doctor. We did counseling at school, and it just, it wasn't cutting it. But it took so long to be able to get to that specialist, to get an appointment, to get scheduled. Is that who bridges that gap for us?
Well, that's a great question. Nationally, there's a shortage of child psychiatrists, and you really need to go to a child psychiatrist. Psychiatry is very different between adults and children. And I wish our child psychiatrist were here today because she is wonderful and a fabulous advocate for our children. But there's a shortage of psychiatrists, and so what's happened is nationally, it's difficult to get in. You have a long wait time, and that's why you have some of these care coordination things that help bridge the gap, so you can get a primary care doctor to give you what you need to get you to when you can get that appointment in.
Right.
And there's a lot of innovative things that are happening in some practices. Some practices are partnering with psychiatrists, like if you're familiar with the MUSC Foster Care Clinic in Charleston,
Yeah.
they have they've contracted with they've got integrated behavioral health with their primary care. And so they have a child psychiatrist that comes so many hours a month and who can help get those things done that you wouldn't otherwise be able to get done. Have you used them before? When you were in Charleston?
Yes. And it's helpful when you have not only like the child psychiatrist, because you don't have access to them all the time.
Right.
You have experienced healthcare providers, the nurses, and the actual physicians who understand childhood trauma, and they can give you resources. They can prescribe medications to fill that gap until you're able to meet with the child psychiatrist.
Right. So your caseworker can be a point person in this, but really maybe these select health teams and other people can help make those connections.
That's exactly right.
And even some schools have mental health services inside the schools that are also connected to psychiatrists. The wait times are still long, but they can be put in place interventions in school until they're able to meet with that psychiatrist.
And I know if you've got a child who's school age and they are having some serious behavioral problems, behavioral health problems, it's hard as a parent.
So hard.
It was hard to raise my own children, and I knew them I knew them. They didn't just get dropped off one day in the middle of the night in my house, And so I really do understand that.
Yeah.
And it's really helping to build a system where we're supporting foster parents and helping them not feel so alone and not feel like they're just
Because, and I think what I'm taking away from this training is that, we need to understand trauma.
Correct.
We need to understand psychotropic medications and some of the side effects that impact of psychotropic medications, because we don't want to be prescribing them for trauma rather than actual mental health issues or disorders.
Or if the trauma gets to the point where it's really interrupting your school life, it's interrupting your relationships with other people, you may still need medication for that.
Yeah. And there are other interventions you can use before you even get to the medications part of things.
Or it might be a combination of
It will take trial and error too.
Yeah.
A lot of that.
Yeah. Oh, I know.
Yeah, I know. I know you know.
Yeah. So thank you. Yeah, everybody. This is so helpful. So now we hear a lot about these child well-being teams.
Yeah. What is that?
Regional,
Yes. Right.
Now, this is not the same thing as the select health team, or is it?
No. It's totally different. So if you think about how we're building partnerships with entities like Select Health to help pull together professionals and help foster parents, support foster parents and birth parents, and honestly, kinship caregivers, as we pull those people together, those folks are we have some on the DSS side and then some on the Select Health side. So on the DSS side, we have nursing staff that will be hiring final two nurses in March. I'm so excited.
Yeah.
And we'll have 6 nurses.
Okay, and those are regional.
Correct, and they're on that wellbeing team.
Okay.
So if you think about a team that's going to look at a child holistically, they're going to look at their educational needs. Some older kids may have charges with DOJ. Look at, are there anything going on there? They're going to look and see, okay, we have children that have developmental disabilities or intellectual disabilities, or they're somewhere on the autism spectrum. So we have individuals that focus on that too. But think of this as like a team of professionals that are not just consultants for the case manager or foster parent, but they're also there to be resources and to help things get done.
Yeah.
Because I hear a lot from foster parents, I can't get my kids where they're so overwhelmed. And I think one of the things that's been very positive about the reforms that Director Leach has brought to us is that we really are looking at ways to support our frontline case managers more.
Yeah. So I just want to make sure that I'm understanding this correctly, and maybe there might be questions from others too. So each region is going to have a child well-being team. Is that what it's called?
Yes. Well, it's called wellbeing teams.
Okay.
No, wellbeing teams.
Wellbeing teams.
There's a leader of that team.
Okay.
And then there's about 11 people on that team. So,
in each region.
So think about, you got a nurse. You got somebody that's going to help get data, all that healthcare data in our system with the nurse. You've got someone who's coordinating therapeutic services like that, the autism or the intellectual disabilities or those kinds of things. You've got someone who's making those connections between education and DJJ and helping to get school records and helping to go to IEP meetings and working with foster parents to help them explain 504 plans, those kinds of things. Then you've got a person, have you heard about the implementation of CANS, the Child and Adolescent Needs and Strength Tool? Well, that will be rolling out later this fall. You
Okay.
come back,
Yeah.
talk about that. But there's a person on that team that's going to help with that assessment tool.
Okay.
And they're going to help make sure that tool's being used to help inform the plan for that child and probably the placement for that child as well, too.
Yeah.
And so then you've also got 2 people on that team that are clinical specialists. So these are mental health clinicians who are there to be consultants for case managers. And then lastly, we have a large number of individualized services that are provided for kids in therapeutic care, and there's someone who helps with that individualized contract. So that's a team.
So now, are these teams? You said you're hiring some more nurses. Your last ones. Are these teams already in place and functioning?
Yes.
Or in every region?
Yes.
In every region.
So how should foster parents be hearing about these teams, or how do you even access these people?
Right. So that's a great question. We're working on a guide. This is
Okay.
brand new to us.
And that's what I was going to ask you. These are brand new. This is not something that has existed.
No, January 1 was kind of the official. And if you're familiar with, are you familiar with Intensive Foster Care and Clinical Services, IFCCS? No, that doesn't mean anything to you. Well, basically what's happened is the people that did frontline work, they've gone to the counties, and then these are the people that are the specialized subject matter experts that are here, and that's those. In essence, that's what those people are. And so those folks are now these well-being teams that are working as helpers to case managers and consultants to help us problem solve when we see barriers, helping us work through issues that case managers might have, find services.
Complex case management, because they are the most familiar with the complexities of case managers. And so they are a resource for our case managers, who will be a resource for our foster parents.
Right. So we're kind of sharing the burden of these responsibilities a little bit, creating more of a support, like a fallback for the foster parents, the caseworkers, and which really boils down to the kids.
Yeah. Exactly. And if all of this doesn't result in anything better than kids, we don't need to be doing it, because that's really why we're here.
Right.
Is to really make sure that kids ultimately get what they need.
Exactly.
And it's complicated, it's frustrating, it can be difficult, and it's hard to keep up with everything. And so it's really
it can be overwhelming, but that's why we're here.
Yeah, we might need to have a whole conversation just about these child well-being teams.
Let's do it.
I don't know. I'm curious.
How would you say?
Foster parents, will you let us know? Do you know about these child well-being teams? Are you utilizing them? We want to hear from you. But as we wrap up, can you tell us just if there was, you have already told us a couple things that you want us to know, but as you wrap up, what do you want foster parents to know about caring for their children's health and well-being, and how they can be successful? So the 2 child well visits.
Yes, if for children of age 2 child well visit, schedule that appointment.
Yeah.
Okay. Let your case manager know.
Yes.
Get us the after visit summary. If you have just 3 things that you take away.
Let's talk about this after visit summary really quick.
Sure.
Can you tell us what it is? I've literally never heard of this, and I've been fostering for 2.5 years.
Okay, so when you go to the doctor gives you a sheet.
I might be crazy. You guys can all get on me now.
No. The doctor gives you a sheet, and it's all the things that happen.
Oh, right.
And then what
Okay.
needs to be followed up on.
Yeah.
When we get that sheet in our system, that lets us know what needs to be followed up on.
So we're supposed to send that to somebody?
Yes, and we have a flyer about that.
Okay, great. So we're gonna link to that flyer,
The flyer,
the after visit summary goes to.
There's an email address that we can send it to. Eventually, you might get to know your regional nurse.
Okay.
So if you know who your regional nurse is, you can send it to their centralized email box. But if you don't even know, like for example, providers might have a child in Greenville, but they're located in Charleston.
Mm-hmm.
So we have a centralized box. If you don't know anybody in the region or county, you can send it here, and we'll route it to the right place.
And the foster parent is kind of doing that manually right now. This is not the healthcare provider electronically sending that.
Well, so we're working through that right now. So
Okay.
there's a lot of providers that do have that. They have electronic drop boxes. We pick them up there. But I've told foster parents, take a picture on your phone. Email us the picture. We don't care how we get it. You can send it by pigeon carrier. You can fax it. You can email it. You can.
So am I in the am I the only one?
No.
Are foster parents doing this right now? Are they sending them?
I think sometimes it's easier for them to get a copy and give it to their LCS or
Tell me what that is.
licensed care specialist for the
And what's that?
therapeutic foster care.
Okay,
They have
okay.
those case managers for the child placing agency.
Okay.
They'll take a copy of those.
Okay.
But most of the times they get a copy and they keep that copy to themselves, or
Mhm.
they ask for 2 copies and give it to the case manager at the monthly face-to-face.
Okay.
So what you need to know is we got to have that right away, because that
Mm.
data, that well child visit, starts a clock ticking.
Right.
And within 45 days, we've got to be able to document in our system, not just the foster parent made it, but we have documented that we scheduled that follow-up appointment.
Mm.
So if a child needed, let's say they need to be seen by a specialist because they're having frequent ear infections, and the doctor says referral to ENT, and so that clock starts ticking the data, that well child visit, and we've got just a short number of days to get that in and make sure we document our system. Here's when that ENT visit is. It's going to be, March the 3rd at 3 o'clock.
Right. And we're hoping that kids aren't bouncing around, but, if they're going home, if they're going to kinship, if they're going to another foster placement, if this is in the system,
Correct.
there is a record, we can look at this.
Exactly.
And we can communicate it. So if you're familiar, if you may have seen it on but the health education passport. Okay.
Okay.
That's a whole other
I know about it,
You
but
know
I've
about
never seen
You've
one.
never seen one. So a lot of that is all the time it takes to get that data in. Well, with nurses, they're entering that data anyway. It's feeding to that passport.
Gotcha.
Okay. So that's the kind of thing that helps really that continuity of care, is that we've got a report. We know that child's supposed to be having counseling, once every 2 weeks. We know that child was on this medication, and we know that child was needed to be seen by a doctor, an ENT, for their, ear infections or what have you.
Right. All right. So we're going to title this conversation Part 1. And then we're going to come back and do this again, because there's a lot more that we need to talk about.
I just want to thank you, because we think of I laugh when we talk about Nikki as our wonderful, phenomenal millennial. But I think about how can we communicate to foster parents? How can we get the word out? And it's flyers, it's emails, it's webinars. But Nikki's like, let's do podcasts and let's do things like this. I'm like, so Nikki's getting us into the 21st century.
That's awesome. And I mean, the reality is we have to, because. How do you reach all these foster parents? But thank you so much.
Yes,
and there are going to be a lot more questions on here. So we're just going to give them your emails.
That's great.
Yeah.
We're happy to help.
All right.
And thanks for your time.
Yeah,
so much,
thank you. All right. And thank you, everybody, for joining us. If you have questions, let us know. We will link to these flyers. We will link to their emails so that you have the resources you need. Thanks so much.
Thanks.